Hey guys, so in this second video we're going to obviously be discussing carpal tunnel syndrome, and we discussed the integrity of your cervical disc and the importance of good posture and how that must be addressed when treating carpal tunnel syndrome. Now, technically carpal tunnel syndrome is compression of the median nerve at the wrist, and when we're doing this for a living, essentially those 8 bones in your wrist get shifted out of alignment, and the tissue within the wrist essentially gets formed with a substance called adhesion, adheres to the nerve, creates a lot of kind of compression in and around the nerve, which can lead to those classic carpal tunnel syndromes, numbness, tingling, pins and needles. So obviously if you've watched our previous videos, you'd see how you're supposed to sit and stand at work. And if you're suffering from carpal tunnel syndrome, I just want you to perform this test. A healthy wrist should see about 70 degrees of flexion, extension in the wrist. And then good range of motion is you should be able to see around 60 degrees of extension in those fingers. So what I want you to do is place your elbow on the desk, extend that wrist to about 70 degrees, pull back those fingers. You should be able to get them past parallel. And if you can do that without pain, you've got a healthy wrist. If you can't get your wrist to 70 degrees, or your fingers won't come past your wrist, you've got what we call misalignments in those wrists and adhesion within and around that median nerve. That's something that needs to be diagnosed and addressed if we're going to get that pain in your wrists and hands and fingers corrected. Hopefully that helped. If you're suffering from carpal tunnel syndrome and you're not finding the results that you need, perform that test. And if you fail it, give us a call down at Advanced Health Chiropractic. Tag share with a loved one. We'll see you on the next one.